recommendation on the bottle. However, not using the proper measuring device can cause underdose or overdose. We really would not like the overdose. The underdose, you probably can eventually fix.
Leave it, yes.
But the overdose of paracetamol frequently, and the other thing that they might be doing as well is using paracetamol by itself, or they may have cetamol nighttime or daytime. They might have something called, let's say they might have another cough and cold preparation, which contains paracetamol in it. So you might be giving the child the cetamol plus the paracetamol, but you already have paracetamol in cetamol. So you have to be very careful about that.
That is too much more.
So that's an example of overdosing. But this morning we are focusing on the measuring device.
Okay, because I've seen people come to the pharmacy, they went to the pharmacy and they took the bottle and pour it in their mouth.
I've seen that all the time. Yes. And they make a fun of it.
Like it's juice.
When I try and say this is not the way, they laugh. They say, I always do that.
Yeah.
Then it's fine. I mean, you always do that.
They just drink it.
It amazes me.
Yeah, I mean that is dangerous.
And they don't listen to you. They think they're having a drink of water.
Yeah.
And that's very dangerous.
Juice.
That's very dangerous. And also we will see too that when you're using the measuring device, whether it is because you have different devices, you have what we call a dosing spoon, we have a measuring dropper, we have dropper syringes, and we have dosing cups. If you want to use a dosing cup, we usually say it's best for children and adults who can drink from a cup without spilling. So you can give them the cup, they can drink, because they're not going to lose anything. So the dosing cup is better for these individuals, either children or adults who can drink from a cup without spilling it. The dosing spoons, they're like spoons with a little hole where the medication goes down into the handle of the spoon. They're best for children who can drink from cups, but often spill some of the liquid because the liquid goes down into the handle of the spoon. So for the kid who can drink from a cup, but they usually spill the liquid, that would be the better measuring device to use. Then we have the dosing droppers or the oral syringes. They're best for young kids who cannot drink from a cup because you get the precise amount in the syringe and you're just going to squirt that in the child's mouth. The only time they're going to, for it is if they spit it out. But if they're going to take it in because you're the one putting it in their mouth, you're guaranteed that it's going to remain there.
Well, parents before used to guarantee it remains there because they used to block your nose, pull your nose and pull it down.
And make sure. And that's not really. I mean, that to them is the most practical thing to do because the kid's going to spit it out, but it's dangerous because you can choke the child because the child would not be able to breathe properly. So you have to be careful as to how you do it, how long you do that. You hold the nose together. And with the one important thing to notice with the oral syringes, never use an IV syringe because you have IV syringes and you have oral syringes. So you need to know which is the oral syringe and which is the IV because the calibration, the way that is, the numbers are on the outside, it's a different measurement altogether. So for oral syringes, make sure you know it's an oral syringe and not an IV syringe.
Ladies and gentlemen, we're talking spoonfuls today on tablets and spoonfuls. We'll be right back after this message.
Leana Salty Dr. Kuti has Rima, we number one, Bali Pies Biology and Letemamo. It is a eulogy. It is number two, Pametemo Asu Ice, Mohani of Widi. Mawidi, Galtis Sotu Capariano. Speak life, man. They mene Alida Kuti, Quick Care Pharmacy. Lay one twila, see what is here and you have 72 hours of sleep because everything about Quick Care Pharmacy speaks of life. Plus, Nani Bell, clean, spacious plants, different list of your medicament packoi, the air condition. Oh, see what is your oasis in a desert land. You just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Care Pharmacy and Halsbro, set up your blood pressure and sugar check one time and get your top up too. And I you put 20 on my cell phone. And of course, over the counter drugs and prescription drugs. Appresently, and ID more individual Quick Care Pharmacy. Her outlook on life has changed. If you any buy medicine, may you pally buy. Actually, make a exercise to live on my saying, leave him away. Get up, lazy Harry. Harry him to Jukadi elastic on last yourself. The last shall be the first Harry. Move that body, Harry. Quick Care Pharmacy over Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4.
Okay, welcome back to Tablets and Spoonfuls. And today we are focusing on spoonfuls particularly. And so, when we get our medication, we now have to ask about the spoons.
Very important.
We can't just depend on the spoons at home, the teaspoon or the tablespoons at home.
Very important, and that's why we say particularly for kids. If it's an adult, the doses for the adult is usually 2 or 3 times the concentration of that for a kid. So you may have to double up on your teaspoon. So instead of taking 1 teaspoon, it might be a situation where you have to take 4 teaspoons, 3 teaspoons. So it's usually a higher dose. But it's important that the parent or the patient themselves ask the pharmacist for the proper dosing device. If they have, some pharmacies have the fancy ones that you can buy. Some people don't like buying it, but I encourage you, because some of those fancy syringes, they have like what we call a budge on the syringe where it fits onto the bottle properly. The proper way to measure is to tilt the bottle upside down, draw the syringe, draw the quantity on the syringe first. You pull it out first.
Like a nurse.
Exactly. What you're trying to do is to put air into the syringe so that you don't have a bubble.
Okay.
Because if there's an air bubble, you don't get the correct quantity.
Okay.
Which in effect is not the correct concentration. So it's a technique of just pulling the plunger down from the syringe. If it's to 5 ml or 3 ml, then once you tilt that bottle over with that punch at the head of the bottle, then you can put the syringe in there and push the air into the bottle and then draw out the quantity that you need. So ask your pharmacist. Even if you have to buy it, I recommend that you do that. However, some of the medication do come with the measuring cups. Make sure that you have one. So do not throw them when you get home. Use them. Let the child drink directly from them, because once you pour the liquid in the dosing cups, if you were to pour it in a spoon, you might drop some, or some might stay in the cup so you don't get the full amount. Make sure they drink directly from the measuring device. All of the devices in the boxes with the liquids, they're accurately measured by 5 ml. So you get the correct concentration. Do not throw them away and take a spoon because you feel more comfortable with a spoon, because that's what happens. Some people don't like pouring into the cups because they do not know, exactly where to stop. They may not be able to read because some of these devices, they have millimeters, they might have cc's, they might have tablespoonfuls, teaspoonfuls, so they can be a little bit confusing.
Confusing. So when it's important to get your grandchildren, your children, or somebody else to help you if you cannot read.
Exactly. But before you leave the pharmacy, make sure the pharmacist look at it and tell you exactly where I should.
Yeah, me say lapu meti.
Exactly.
Lapu wifi.
That's right. So this is important that we do that. We want to note that we never drink directly from the bottle. Not an adult, not a child.
Beer.
Never drink directly, straight from the bottle. And when you're measuring the liquid, you try and do it at eye level. Never guess the dose. So you put if it's the dosing cup down, and at eye level, you pour the liquid in there and look at the mark on there. So do not guess and say, okay, I'm going to hold it up there and try and figure it out. No, you're not going to do that. And you're going to use, if you're doing the over-the-counter, you're going to use the dose shown on the prescription label. This is especially important when giving liquids to kids. You do not give more than what you see on the label, or ask your pharmacist. Some people might say, okay, how much do I have to give her? I say, that's okay. I will give you the measurement, because I will take the child's age and look at the weight and say, okay, well, it's okay, even if it's for an adult, but you can give half of that or 1 ml of that, because we calculate it to know the correct strength of the drug that we have to give you. That is why it's important to speak to your pharmacist. Do not assume that you know. It is critical. The manufacturer have, by the USP standards, to put what the recommended dose is. However, that can be calculated to more or less by the pharmacist or the doctor. So ask your pharmacist a question. Okay? Do not play that you know it because it's for the health of your child. It is critical. You need to do that. As with other medicines, it's important to follow the directions of your doctor. So if your doctor says this is how much you have to give, you're not going to say, oh, the doctor tell me that that's too much and I'm going to give that to my child.
People say that all the time.
If you're not comfortable, ask the doctor a question. Why you want me to give so much? Sometimes they come to the pharmacy and the strength of the drug is not the strength that is for the size of the bottle that the drug is in. For example, you have to give maybe 300 milligrams every 8 hours. The bottle comes as a 100 milligram per teaspoon, but it only holds 100 mLs of the liquid. So I may end up having to give you 3 bottles. Some will say, what? All that medication? It is not all that. It lasts for the time, for the next 7-10 days. You get the correct concentration, but you get 3 bottles to make it up because of the type of drug. The shelf life of the drug could only be 7 days or 10 days or 14 days. So it has to be in a certain quantity within the bottle. For some antibiotics where you have to reconstitute, when you see a shaking, that may be only for 5 days or 7 days. So the amount we give you is for the amount that you need. There might be some over. So that is why it's important to never go against your doctor's order. Speak to your pharmacist, speak to your doctor, get a clearer understanding. As I said earlier, for adults, we have larger doses of the medicine. So you may have to measure more than 1 teaspoon to get the amount that you need for the over-the-counter. Because you can use a child's liquid. People find, oh, that's for a child. Oh, that's for an adult. I cannot use that. No, you can. But if you're not sure, ask your pharmacist and we may show you, okay, well, instead of taking 1, you might have to take 4. Always shake the bottle properly to ensure that all the drug particles are evenly dispersed through the bottle.
Because sometimes it
settles. Yes, so you have to shake it properly. Measure the dose carefully using your measuring cup or your measuring syringes at eye level. If using a spoon, measure out a level spoonful and swallow the medicine from the spoon. So you fill it right up to the spoon and you swallow that medicine. The medicine spoons are designed to give 5 ml dose. So if you need more than this, you will have to repeat it. So if they tell you, okay, well, you need to give 2 teaspoons, 10 mLs, you're going to give 2 of that teaspoon. Because the spoon, the highest quantity goes to is 5 mLs.
Okay. But what we've learned today is that your mama's spoon, your spoon at home that you drink or you eat your food with, you drink your sauce, your soup, whatever, this is not a measuring spoon. You need to get proper spoonfuls at your pharmacy and make sure you have the right measuring device.
Yes.
So you can take your medication so it will be effective. Not just taking a spoonful, the same spoon that you use at home to eat at your home. That is very, very important. That's your program today, ladies and gentlemen. Tablets and spoonfuls.
Leana Salty Dr. Kuti has Burima, we number 1. Bali PS Biology and Letemamo. It is a eulogy. It is number 2 Pametemo to ice more honey of Widi. Mawidi, Keltis Sotu Kapaliano. Speak life, man. They mene Alida Kuti Quick Care Pharmacy. Lay one trailer. See what this year and Uve up with 72 hours of sleep. Because everything about Quick Care Pharmacy speaks of life. Plasnani Bell, clean, spacious plants, differently staffs your medicament pack, the air condition. Oh, see what is your oasis in a desert land. You just want to sit and relax and enjoy the health education corner about current health issues. Go to Quick Care Pharmacy Halsbro, set up your blood pressure and sugar check one time and get your top up too. And I you put 20 on my cell phone. And of course, over-the-counter drugs and prescription drugs. I present the NID more individual Quick Care Pharmacy. Her outlook on life has changed. If you buy any buy medicine, may you pally buy him. Actually, make a exercise to live on my tank and leave him away. Get up, lazy Harry. Harry him to Jukadi elastic. We want last the last shall be the first, Harry. Move that body, Harry. Quick Care Pharmacy over Monday, Wednesday, Friday from 9 to 6 and Tuesday, Thursdays and Saturdays from 9 to 4.
Today we concentrated on spoonfuls and make sure you get, as we said, your measuring device from your pharmacist. Don't just take it for granted that you have spoons at home. No. And you can also call us. Tell us the number to call.
440-8600.
440-8600. Call us with your comments,
your questions. We'll be happy to speak with you, or even walk into the pharmacy. We'll be very happy to speak with you as well.
And Quick Care Pharmacy, of course. Thank you very much. See you next week on Tablets and
Spoonfuls.
All right. Take care now. Bye. Good afternoon.
Tablets and spoonfuls. Tablets and spoonfuls. How to manage your body. Taking medication while at home. Correctly taking your meds will help your system. Tablets and spoonfuls for Quick Care Pharmacy. Tablets and spoonfuls for Quick Care